everybody. Today we're talking about exercising for health. Now the WHO, the CDC, and the American Heart Association all recommend that adults get at least 150 minutes per week of moderate intensity aerobic activity. Now before we talk about how to realistically achieve this recommendation, I want to give you 3 important points that can help you make the most out of these guidelines and get you well on your way towards better health and vitality. So let's go ahead and get started. Point number 1. 1 minute of vigorous intensity activity is actually equivalent to 2 minutes of moderate intensity activity. So to achieve 150 minutes of moderate intensity activity per week, like the guideline recommends, there's 3 different ways you can do it. You can either do 75 minutes of vigorous intensity activity to meet the requirement, or you can mix and match. Say do 25 minutes of vigorous intensity activity and then another 100 minutes of moderate intensity activity, or you can just stick to the 150 minutes of moderate intensity activity. So there's multiple different ways you can achieve this recommendation. Point number 2, in addition to the 150 minutes of aerobic exercise activity, it's recommended that you engage in at least 2 days per week of muscle strengthening activities in which you engage most of your major muscle groups. Now there's a couple different reasons for this recommendation. The first one is that muscle strengthening activities are obviously going to increase your muscle strength, but it's also going to increase your flexibility, your stamina, your coordination, and your balance. So this is going to allow you to live a much more active and healthy lifestyle, especially as we age. The second reason for this recommendation is that muscle strengthening activities increase your muscle mass. And as we all know, muscle is a metabolically advantageous body tissue when compared to other body tissue types. So more muscle mass means better effect on your sugars, your blood pressure, your body fat, and your overall cardiovascular health. So that's a reason for that recommendation. And point number 3, 150 minutes of aerobic exercise activity per week is the minimum. Experts actually believe that the more you exercise above that minimum recommendation, the better health effects you're going to see. So don't stop at 150 minutes. If you can, get out there and do 170 minutes, 180, 200 minutes per week. Whatever works for you, the more exercise, the better. Okay, now that we talked about those 3 important points, and with the goal of 150 minutes per week of moderate intensity aerobic activity, how do we achieve that goal? It's really important that we are able to delineate between light, moderate, and vigorous exercise intensity. And I'm going to teach you 3 different ways you can do that. The first and easiest way is by feel. Understanding that exercise induces changes in our breathing and causes a degree of breathlessness. You can use this simple tool to gauge your exercise intensity. With light intensity activity, you're going to be able to converse and sing a song. With moderate intensity activity, you may be able to converse, but you won't be able to sing. And with vigorous activity, you won't be able to converse or sing. In fact, you'll probably only be able to say 1 or 2 words at most before you have to stop and catch your breath. So there you go, that's the easiest way to do it. The second way to do it is by using your maximum heart rate calculation. And you can calculate your maximum heart rate with the formula 220 minus your age. So for example, a 20-year-old would have a maximum heart rate of 200. So go ahead and take 5 seconds to calculate your maximum heart rate. Okay, now that you have your maximum heart rate, you can use this tool to estimate your degree of exercise intensity. Light activity is going to be about 50% or less of your maximum tolerated heart rate. Moderate intensity activity is going to be about 60% of your maximum heart rate, and vigorous activity is going to be about 80%. So for example, the 20-year-old would have a light intensity activity heart rate target of about 100 beats per minute or less. For moderate intensity activity, they're shooting for about 120 beats per minute, and for vigorous activity, they're shooting for about 160 beats per minute. Now the third and final way you can estimate your exercise intensity is with a scoring system called METS. MET stands for metabolic equivalence to sitting. And what it is, it's a scoring system that expresses your energy expenditure compared to the energy that you would expend from just sitting down doing nothing. For example, if I'm doing an activity that requires 4 METs, theoretically I will be burning 4 times as many calories that I would be burning if I was just sitting on the couch. Okay, so while it can be difficult to understand the concept of METs, it can be very easy if you have a piece of workout equipment at home or at your gym that expresses your workout in terms of METs. So the scoring system for METs is as follows. For light activity, you're looking for about 2 to 3 METs. For moderate intensity activity, you're looking for about 3 to 6 METs. And for vigorous intensity activity, you're shooting for anything above 6 METs. So that's pretty much it. That's exercising for health in a nutshell. I hope you enjoyed this video and I hope you learned something. So I'm going to go ahead and get started on this bike and get up to 5 METs and stay there for 150 minutes.